It's 6 o'clock on Monday, the 8th of June. Good morning. This is Today with Sarah Smith and Justin Webb. 12 minutes to 7 is the time. Some schools in the northwest of England have delayed reopening because the local R number, the measure of the rate of infection, could be above 1, meaning people with coronavirus are infecting on average more than one other person. Mayors in Manchester and Liverpool as well, the two very powerful local mayors, are both suggesting that people should, if possible, stay indoors. Tom Solomon is director of the UK's Emerging Infections Research Unit, but also a consultant working in hospitals in Liverpool. Morning to you.
Good morning.
Do you think the mayors are right?
I think they're right to be concerned, and I think there is a worry, particularly in the northwest, that the R number, according to one study that's come from Cambridge and Public Health England, Cambridge University, the R number may have crept above 1. And so, I do have sympathy for the mayor's view.
An R number is necessarily a snapshot of some time ago, isn't it? Is there evidence from people presenting with COVID, or indeed just analysis of what's going on in the community? Is there evidence that actually things are getting worse?
You're right. The R number, I think probably a lot of people know this now. The R number is the reproduction number, and it tells us for every person infected, on average, how many other people they will infect. And if that number is less than 1, then it means overall the outbreak is going away. And if it's greater than 1, it means overall it's increasing. But it does take time. So an R number that now appears to be at 1 or maybe even greater is not going to be reflected in an increased number of patients in our hospitals today. It's going to likely be an increase in a number of weeks, couple of weeks. And similarly, the increased deaths would be a couple of weeks after that. So really, the R number is an early warning system in that sense. And if you wait until you actually do start seeing more patients in the hospitals or more positive swabs out in the community, then you're a bit late, really.
But what's your view of it being an early warning system when, as some people point out, if you have an outbreak of an infection in a particular place, for instance, a care home or a hospital, then that might affect, because it's an average, isn't it? That might affect it. And actually, community-wide, you might still have a good picture.
Well, it's true. Yeah, we're certainly the number of cases in care homes and hospitals has been greater than in the community as a whole. But these are linked. If you've got more cases, if cases are going up in care homes, if the numbers of people becoming infected in hospitals are going up, then will also likely spill over into the community as a whole. People are not in complete bubbles in that sense. So, and it's an average, but if the trend is up, then I think that's an important warning.
What do you think the impact of the demonstrations could be?
Well, I think it's really concerning. I completely understand people's desire to demonstrate, and I don't know about their right to demonstrate, but it's very unfortunate timing for this to happen at the same time as we're trying to get this outbreak under control.
But unfortunate, why though? What do you think the impact will be? Could be?
Well, we know that on average in this country, at the moment, or at least 2 weeks ago, about 1 in 600 people are infected on average. And so the instruction in general is don't meet more than 6 people in a garden and keep well away from each other. And that will hopefully stop the virus spreading.
Just as a scientist, I mean, never mind with the rights and wrongs of the process, just as a scientist, when you look at those groups of people, you are certain, are you, it is being passed on from one to, well, another, more than another?
Well, if you've got thousands of people together, then there is an increased chance of the virus spreading from one to another. I don't think you need to be a scientist to work that one out.
Professor Tom Solomon, thank you very much.